Okay, in this section we will talk about growth and development of the newborn and the infant. The newborn refers to the first 28 to 30 days of life, and during this period of time there is rapid growth and change. The primary task of this stage is to transition from intrauterine life to extrauterine life. Once again, the newborn is referred to the period of time which is the first 28 to 30 days of life, and then the child will be referred to as an infant. This is chapter 7 in your pediatric book. All right, the care of the newborn. One of the main nursing goals is to prevent loss of body heat. So thermoregulation is very important with the newborn. All right. Heat loss is caused by convection, conduction, radiation, and evaporation. Heat loss is caused by convection, conduction, radiation, and evaporation. Evaporation is defined as the loss of heat when water on the skin is converted to vapor. So the nursing strategies used to prevent this is to remove any wet blankets or diapers that come in contact with the newborn's skin, and to immediately dry the newborn after birth. So those are ways to prevent heat loss through evaporation. Convection, the transfer of heat when the flow of cool air passes over the newborn's skin. The nursing strategy is to protect against any drafts from open windows and doors, and prevent placing the child up under an air conditioning duct. And here's some examples, once again, of evaporation and convection. All right, conduction is the transfer of heat when the infant comes in direct contact with a cooler surface. Nursing strategies to prevent this is to always protect the infant and don't place them on a cold mattress, not to place them on a weight scale without having something underneath the infant, being sure that we don't touch them with cold hands or wrap them in cold blankets. Radiation is defined as the transfer of heat from the infant to a cooler surface or object, even though the infant does not come in direct contact with them. And the nursing strategy to prevent this is to protect them from outside walls or from window drafts. And once again, door drafts are also the same. These are two illustrations showing conduction and radiation. All right, let's look at nutrition. Nutrition is very important as far as growth and development for the newborn. Depending upon the mother's choice, the infant will either be breastfed or formula fed. Breastfeeding. When the mother is breastfeeding, she generally will need assistance with proper latching on and proper techniques to be used to remove the infant from the nipple. If the mother is formula feeding, the mother will also need education on how often to feed, how much should the infant take, and how to mix the formula. As far as on-demand feedings, this is one of the newest things for mothers. Instead of placing the babies on a rigid scale, such as formula fed every 4 hours, they're actually feeding the babies on demand. So if they cry and they're hungry, they give them more formula or they breastfeed them. All right, let's take a look at play and other activities. For newborns, it is good to provide them a black and white nursery or something with bold colors so that they can learn to distinguish against the dark contrasts and the light contrasts. You want to be sure to hang the mobile on their cribs 8 to 10 inches above their face. Okay, 8 to 10 inches above their face. Another good thing for newborns is to have items which are musical. Musical toys are very good for newborns. Let's look at health promotion and maintenance for the newborn. Just one minute. All right, let's look at health promotion and maintenance. At birth, the infants are treated with ointments or drops for to prevent possible complications due to exposures to STDs. Once again, infants are treated with erythromycin drops or ointments to prevent any cross-contamination during vaginal births to any STDs. They are also given vitamin K, and this injection is administered immediately following birth. It is given IM. Infants are also screened with their APGAR at birth, and prior to being discharged from the hospital, they have hearing screening that is done. Another health promotion that you need to be very familiar with is immunization. I would advise you to learn your immunization schedule. I would use the one which is in your textbook. It's Appendix C. That is the one that you will be utilizing as far as for testing purposes. So you will need to know when the child gets their first polio, when the child gets their first diphtheria, when they get their MMR. All of that will be important to know. Okay? Safety promotion and injury prevention. Safety promotion and injury prevention. Identification. Once the newborn is delivered, they are then placed, they have a mother's bracelet put on them. The mother has a infant bracelet, and the significant other gets a bracelet. Okay, all these bracelets have the same number, so it's important that when the nurse brings the infant to the room that she checks to make sure that those identification numbers match. So once again, identification is important as far as making sure that we identify the right mother with the right infant. Okay. Another thing that's important as far as safety is car seat safety. It is important that the parents know how to properly place the infant in the car seat and how the car seat needs to be installed into the car. Okay? They do currently have car seat safety programs in which you can come and bring your car seat. It can be checked for safety measures, and they will also assist you in mounting or placing the car seat into the car. Remember that newborns and infants are in the rear facing seats until they reach 40 pounds. Okay? All right, let's take a look at Chapter 8, the growth and development of an infant. This period of time is, once again, a rapid time for growth and change. The child develops attachments to the family or the caregiver, and trust develops during this period. The weight doubles from the birth weight within 5 to 6 months. It triples in 1 year. So once again, the weight doubles in 5 to 6 months and triples by age 1. So this is a very rapid time for growth. The height increases. The head growth is the most rapid. All right? At birth, remember that the head circumference exceeds the chest circumference. Generally speaking, at birth, the head circumference is always going to exceed the chest circumference. All right. Let's look at reflexes. What type of reflexes does the infant have? The infant has multiple reflexes. We have the Morrow, the tonic neck, gag, rooting, and they also have the Babinski. All right, the Morrow is the startle reflex. This is the startle reflex, and it is initiated by clapping your hand above the baby's head. You will see that they will change their position at this time. They have the startling look. Their arms are bent, their legs are bent. All right, the gag reflex, that is generally assessed when you are checking the oral area as far as making sure that the palates are intact. You can actually use a tongue blade and touch the back of the throat, and the baby will have a little gagging reflex. Rooting, this happens when you stroke the side of the infant and they will turn their mouth in the direction in which you have stroked the cheek. The Babinski, this is the one that we do on the feet, remember. You take and you make a little J on the foot and the toes should fan out. This is positive until about age 2. Okay? This is positive to about age 2. All the other reflexes, the Morrow, the rooting, the tonic neck, all of those are going to be gone by age 4 months, with the exception of the Babinski. All right, let's look at some physiological development of the infant. In the first illustration here, this is a child at 1 month, 2 months, and then 4 months. See the head lag? No control of the head or neck. Here we have a little bit more, and here we have full control of the head. Okay? Here we have an infant sitting at 1 month, 2 months, 4 months, 7 months, and about 8 or 9 months here. So you can see within a year's time how quickly they physiologically they develop and psychologically they develop. Okay? We've got one more illustration here. We've got some points that I want you to remember. Let's see. As far as with most children, developmentally, by age 4 months, they're going to have gained their head control. By 5 months, they're going to be able to roll from their abdomen to their back. And by age 6 months, they'll roll from their abdomen, from their back to their abdomen. Let me repeat that. At age 5 months, they can lie on their abdomen and they can flip to their back. Okay? By age 6 months, they can be lying on their back and turn to their abdomen. By 8 months, they can sit alone. Generally, they start to crawl before they walk. And let's see, they walk alone generally by age 12 months, which is 1 year. Okay? All right. So those are some gross motor skills. Here's some fine motor skills. Once again, when they first start grasping items, let's say about 5 months, they're going to pick up that item using their whole hand. They do a two-handed approach at about 5 months. At 6 months, they're able to hold their bottle. At 7 months, they can transfer an item from hand to hand. And then at 10 months, they're able to pinch things up with their fingertips. Okay, like pick up a pencil or a thin item with utilizing only their fingertips. Okay. All right, sensory development, such as with hearing. Hearing and touch are well developed at birth. They actually do a hearing test to make sure that the ear canal is clear. Sight fully develops at usually about age 6. However, you can actually identify if the child is having problems with their sight at age 3 and 4. If they are able to identify certain objects, they do have vision tests, which have like cat, dog, car, so the child can actually pick out items. So once they've developed that much language, you can actually, if they're having problems with their sight, they can have visual testing at that time. All right. They've developed their preferences as far as taste by 6 months. They will respond to their own name by 7 months. And they can, usually by age 1, they have 4 words in which they can speak. And as I said earlier, growth and development varies depending on children. Some children may know more than 4 words by age 1, and other children may only know those 4. So, mom, dad, no, and yes, things like that. It varies depending upon the child. All right, let's look at communication. Communication, we have receptive language and expressive language. Receptive language, this is the ability to understand words. So when they actually understand cup is a cup, or the cat is a cat, that would be receptive language. Expressive language is the ability to speak words, meaning that they can actually put words together and make a sentence. Okay, they can express themselves. All right. Temperament. Temperament does vary depending upon the child. Not all children have bad tempers. They are generally born with temperamental characteristics, and dependent upon their environment and their dependent upon the parents' child rearing techniques, temperaments are handled in various ways. That's what I'm trying to say. Just one moment. All right, as previously stated, temperament, children are thought to be born with a specific temperamental characteristics, and based on the parenting techniques in the surrounding environment will that varies, and then that will influence the child's temperament, is what I'm trying to say. Okay, let's move on to nutrition. Human breast milk is the most complete and easily digested. That is usually why it is strongly encouraged, because there are very few incidents in which, I would say I've never heard of an incident in which a newborn was allergic to breast milk. Okay. Commercially prepared formulas, we do have some infants who are allergic to the iron, who have complications related to the iron. We also have infants which have problems digesting the commercially prepared formulas. So they are good, and they have all the nutrients that the newborn needs until they are actually eating on their own. They are recommended, as I stated, up until the age of 12 months. Okay, let's look at foods. We strongly encourage mothers to introduce foods one at a time, and this is related to allergies. They should start off with rice or oatmeal. Okay, and that is because rice has been found to have the least amount of allergies. After rice, that's rice cereal or oatmeal cereal, then they move to vegetables, and they should, as I said, try one vegetable per week. Green beans, sweet peas, corn, not to mix them because you want to be able to identify what the child is allergic to and what they will and will not eat. Once you've done all the vegetables, then you would introduce the fruit, then juices, then meats, and then eggs. All right. So the guide to introducing the food, this is in your text on page 245. You want to remember rice cereal, vegetables, fruit, juices, meats, and then eggs. Why do you think we don't introduce them to the fruits first? That is correct, because the fruit is sweet, and once they start eating that, they may not eat the vegetables. Okay? All right. Let's look at play for the newborn. Once again, newborns like mobiles, just like, or I should say infants like mobiles, just like newborns. They like to have sensory stimuli. They like musical toys. You want to be sure that the toys that are left for the infant to play with do not have any small parts that can be removed and placed into their mouth. Be sure that all toys are appropriate for the age. With infants, you want to be able to stimulate all their five senses, and you always want to praise them for anything that they do. Another thing that is good for infants is for you to read to them. Reading is it's a way of getting the child used to reading and making them enjoy reading. All right, let's look at health promotion. Health promotion begins with health screening. Screenings are done at the hospital and followed up with home care if needed. One of the tests which is done is what is known as the phenylketonuria, PKU. This test is done prior to the infant leaving the hospital. It is sent to the state. If you never hear anything from them, that means that it was negative, and that is good. If you hear from them, the health department will have a nurse who will notify you, and she will come out and discuss the special diet that the child will have to be on. This test has a protein deficiency. The child will have an inability to digest a certain protein, and so they'll be placed on a certain diet. Other screenings that are done, hypothyroidism is another test that is done on newborns. It's part of the PKU. And once again, if this is found to be negative, you never hear anything. If it is found to be positive, then you would follow up with your physician, and he would instruct you on the care of the infant. Others, health promotion, immunization. Immunization, once again, between 2 months, 4 months, 6 months, all that is important. Also, visual screening can be done. All right. Okay. Let's look at dental care. I know you're saying that's kind of early. Well, it is important prior to the development of teeth that we make sure that the mother understands that she should not, once again, let the baby sleep with a bottle, because if she does get used to propping up a bottle or sleeping with a bottle, sometimes that can increase the risk of not only thrush, but it can also harm the teeth that will be coming in. Okay? So, as far as the use of pacifiers, there are pros and cons with that. Some people don't find an issue with it. There has not been any research to say that pacifiers harm the development of teeth. However, there's at a certain age, there should be a time in which the pacifier is removed. But there is no research saying that the use of pacifiers will harm the teeth in developing. All right, for those that do not have, who may be in very rural areas or for other countries, it's very important that the infant does have fluoride supplements. So if perhaps you are, let's say, overseas in a foreign country that does not provide fluoride in the water, it's important that you get fluoride supplements and provide those to your children so that their teeth will develop properly. All right, let's look at newborn sleep. When we think of newborn sleep, we think of colic. Usually by the age of 3 to 4 months, the sleep patterns have been established. We always want to provide the mothers information on sudden infant death syndrome, SIDS. At this point, research states that we are placing the infants supine on their backs to prevent SIDS. We've gone pretty much full circle in the 30 years that I've been in nursing. We were on the back, we were on the side, we were on the abdomen, and now we're back to the back. So for testing purposes and for any information that you provide to your parents, as far as SIDS, you are to place the baby on a firm surface on their back to prevent any SIDS. Okay? You also want to be very careful about placing large stuffed animals in the crib with the infant, because remember, at this age, they don't have full control of their neck, and so if something falls on top of them, they can suffocate. All right, let's look at colic. Colic is a recurrent episode of unexplained crying and inability to console the infant. Once again, colic is defined as recurrent episodes of unexplained crying and inability to be consoled. You do have in your textbook some treatments to help treat the colic. This is in your textbook. One thing as far as treatment, you want to be sure that you feed the infants slowly and you burp them frequently. And it's important not to overfeed them. You want to avoid gas-forming foods. Swaddle the infant very tightly in blankets. A lot of them like to be swaddled. Sometimes using a swing will help babies who are have colic. Music, walking and rocking. And sometimes these infants just are inconsolable. You know, we've all heard horror stories of people driving their newborns around the neighborhood because the infants generally go to sleep with movement of the car. Sometimes that's what you have to do. But one good thing about colic is that it does eventually, it will go away. It just takes a little time as the infant grows. Okay? All right, let's look at stranger and separation anxiety. Stranger and separation anxiety. This usually emerges about 8 months to 12 months of age, and it will peak between 15 to 18 months. So you'll see that they will start to have anxiety about strangers or new people, and also about being separated from their caregiver. This starts at about 8 to 12 months, and then it's going to peak at about 15 to 18 months. Separation anxiety occurs when there's separation from the caregiver. The infant cannot understand that the person will return. Over time, the child will be able to cope with this. Stranger anxiety occurs when an unfamiliar person approaches the child. Initially, the caregiver and the stranger are seen together for the child to notice. As the child grows older, they'll be able to recognize a stranger, even if the caregiver is not present. All right. Stranger anxiety occurs when an unfamiliar person approaches the child. Initially, the caregiver and the stranger are seen together for the child to notice. But as the child gets older, a stranger can be recognized even if the caregiver is not present. And generally, the reaction of the child is going to depend upon the way in which the stranger approaches. Okay? So, the way in which a stranger approaches the child dictates the amount of reaction the child will have. All right? Okay, let's look at safety. Remember that all infants should be restrained in rear-facing car seats. Okay? Be sure that the side rails of the crib are always kept up. Be sure to always check the temperature of the bath water before putting the child into the water. Also, the formula in the food. So be sure to check temperatures of bath waters, formula, and foods before introducing it to the child. Teach injury prevention as far as falls and suffocation, and not touching hot items because they can get burned. All right, on page 261, you'll see there is a general safety checklist, and it goes over how you need to make sure that medications are placed out of the reach of young children, how you need to lock up hazardous materials, especially those that are in cabinets in which in which small children can reach, especially at 12 months of age. They can, at that time, they're crawling and they can get into things. All right. Lastly, let's look at the child's reaction to death at this age. At this age, as far as infants, they are going to lack the understanding or the concept of death. They may react to the loss of a caregiver, meaning that they're going to have some anxiety. They may cry a lot. They may be sleeping more or eating less because they're not, they have not built that trust with one person. So infants react to loss of a caregiver with behaviors such as crying, sleeping more, and eating less. They are aware that someone is missing, and they may experience, once again, separation anxiety, but they don't fully understand or have knowledge of the concept of death. All right, that ends newborn and infant section as far as growth and development. We will next do toddler and preschool.